Welcome to Living Healthy Chicago. I'm Jane Klaus. We're starting today's show talking about the power of positivity. Staying focused on the future can go a long way when you're working your way back from a health challenge. And our first guest shares how a positive attitude helped her rehab after suffering a stroke. Dr. Sheba Ansari Ali's health issues began with a bout of coughing.
I noticed some intense pain in the back of my neck. It was like electric almost. And it only lasted for a few seconds. And then it went away. And then that night, the pain came back. I couldn't go to sleep. It had kind of radiated to between my shoulder blades. And it was up the back of my neck.
That pain persisted for an entire week, keeping her from getting a good night's sleep. And then one day, it was suddenly gone. But she started to feel dizzy.
The spinning was just nonstop. I went into the bathroom and I threw up like 5 times and I didn't feel any better. So I lay on the tile floor and that's when I realized I couldn't move physically. I said, wow, I'm having a stroke.
Dr. Ansari Ali also realized that because she couldn't move, she was experiencing locked-in syndrome. It's a condition where a person can't move but can feel and process what's happening around them.
And at that point, my husband was worried because I was vomiting and then it was just quiet, I think. And so he came to check on me. And again, in locked-in syndrome, on the outside anyway, you look unconscious.
She was rushed to the hospital. After examination, the medical team determined that she was having a stroke and suffering from locked-in syndrome.
They have to make sure that there's no bleeding in the brain before you give a patient TPA, because a TPA stands for a tissue plasminogen activator, and that's a very strong blood thinner. So they passed me through the CAT scan, didn't have any bleed, and so then they gave me the TPA, and then suddenly I realized I could move my right side again.
After that, doctors made sure the clot in her brain was completely dissolved. She then spent several days in the ICU before going to rehab. Here to tell us why rehab is so important for stroke patients is Dr. Mahesh Ramachandran from Marion Joy Rehabilitation Hospital. Now, doctor, I think we should start with the basics. What's actually happening to the body when someone is experiencing a stroke?
When someone has a stroke, there is a lack of blood flow to part of the brain. And so when the brain gets affected in certain areas, the area that the brain helps control in part of the body gets affected as well.
Now, we're talking about this locked-in syndrome. How many stroke patients will experience this?
This is a relatively rare form of stroke. It affects something called the basilar artery. It affects an area of the brain called the pons.
So does having locked-in syndrome then change the approach to rehab?
Depending on the severity of the locked-in syndrome. Some locked-in syndrome patients, all they can do is move their eyes. So that is a completely different approach to therapy as opposed to somebody with partial locked-in syndrome that may have some movement in one of their arms or legs. The majority of stroke patients will get 3 disciplines of therapy when they come to a rehabilitation hospital. One is physical therapy, where they'll work on lower extremity strengthening and gait and mobility. The second is occupational therapy, where they'll work on activities of daily living, such as feeding, bathing, dressing, and toileting. And the third is speech therapy. Well, they work specifically on speech, swallowing, and cognition. Most of the patients after they've had a stroke typically get the maximum improvement within about the first 6 months following their stroke.
They have you work on everything and anything, and it's exhausting. A lot of manipulation stuff, trying to write again. For speech, they had me do like maybe 10 tongue twisters, and for comprehension, they would have me read a paragraph or try to read it and then say, what I thought.
After a month of inpatient work, she was able to go home and continue her rehab there.
I never focused on what I couldn't do. I always focused on what I could do, and then I would try to work around the rest of it.
About 70% of our patients who have finished a stroke rehab program are able to go back home, and the rehabilitation process is crucial in that recovery.
Always being optimistic, that's what it is. Keep doing what you need to do literally for the rest of your life, because you're going to have to maintain what you got back. Focus on what you can do.
All right, if you liked this video and you want more information about living a healthy life, just subscribe to our channel. We're happy you're here.